Okay, guys, welcome to another episode, Latarjet Diaries. Today we have something special going on. Thank you for this opportunity to have a conversation. Let's just start with the introduction. What's your name? Where are you from? What you do in life, if you want.
All right, we will start at the first. I will say Bismillah. My name is Mutaz Al-Blushi. In English, they say Mutaz.
Mutaz.
Okay, I'm from Oman. A lot of people maybe didn't hear Oman before. It's a big country in Gulf countries. We are nearby Emirates, Dubai, Saudi Arabia.
Mm-hmm.
Yeah, and I'm 29 years old.
Okay.
Yeah.
And right now you are in Germany. Is that correct?
Yeah, I'm in Germany.
Okay. Can you maybe share why you are there?
Uh, let's start from the beginning. That will
Sure.
be okay. Back to 2017,
Mm-hmm.
I was playing football. You know, we love football, soccer. Uh, so I tried to do something. The ball was in the air, so I tried to do that bicycle kick.
Mm-hmm.
So I fall down directly on my shoulder. So my shoulder has dislocated at that time in 2017. My friend helped me and they tried to do back the shoulder in the right position.
Mm-hmm.
So they did it. So after that, it became like a usually thing. Everything I do, anything like any move or something, the shoulder will be dislocated. So I used to for that until 2019. So I decided to do a surgery in
Mm-hmm.
country in Oman. So I did the surgery. They did the Bankart surgery, and everything was good, great. Everything was smooth. So yeah, until 2024, I'm working army actually. So, you know, for promotion to get more promotion, you need to pass many tests, you know, like
Mm-hmm.
exam, like physic exams. So in that time, I was doing like a push up. Okay. So I remember that day it was hard and it was hot also. So I was doing push up and I was tired. So yeah, in that time was doing push up. The shoulder has dislocated again after 4 years of the
Mm-hmm.
surgery.
Wow.
So yeah, they took me to the hospital directly. I met the doctor. He said we will need to do a surgery for you, but not the normal surgery, not the Bankart surgery by arthroscopies.
Mm-hmm.
We will do Latarjet surgery. So I didn't hear about Latarjet or something, or anybody did a Latarjet surgery in that time.
That was it 2024? Is that
Yeah,
correct?
yeah, in August exactly.
Yeah. Okay.
So yeah, and the next day they said for me before they do the surgery, we will try to take the bone graft from here,
Mm-hmm.
from the crocoid bone, and they said if it's not enough, we will take from the hip, from your hip.
Oh.
So yeah, I said okay, all right. So they did the surgery for me in that time in August 2024. After the surgery, the second day, I wake up. I didn't feel my hand at all.
Mm-hmm.
So there was numbness and there was rest drop. So it was bad actually. So I asked the doctor, so what's happened? I'm not feeling my hand at all, and there's a rest drop. So he said
What?
maybe
What? Can you just say? So you didn't feel your hand, and what was the what? The wrist? Was it the wrist drop that you say, or?
yeah the rest was drop. I had the rest drop.
Oh, okay, okay, yeah, okay, right.
So yeah, and then it was numbness. It was like fire in my hand.
Mm-hmm.
So I told the doctor what happened to me. He said maybe because of the anesthesia, or maybe because of the injection after the surgery. We give to injection here. Do not because after the surgery will you will be painful for you. We will give you a injection for you.
Yes.
So he said, don't worry, just a few days and everything will be good. So yeah, after 4 days, they discharged me and they said, just do like, try to do move more like a small physiotherapy for your hand, like a handling ball, like that. So yeah, I tried for 1 week, 2 weeks, 3 weeks. It didn't work at all. So I back to the hospital, to the doctor. I told him. So he said, okay, we will try to do the nerve test, you know? So they did the nerve test and the result was the radial nerve has injured.
Which nerve?
Radial nerve.
Yeah. Okay.
So they said the positive thing, it's not that the nerve has not cut it.
Not cut off.
Yeah. There's maybe like pressure on the nerve. Or maybe we don't know, but we believe it's not cut it off. So I said, okay. So after 1 month, the nerve has become better, because of the physiotherapy. So I started physiotherapy after 1 month for at least maybe, let's say, 3 weeks. So in that time, I was doing physiotherapy in hospital. I remember when I was doing physiotherapy, the shoulder has dislocated again.
Wow.
Yeah, because the doctor told me maybe because your muscle are very weak and the muscle are not respond from the nerve. Maybe because of that.
Wow. So how long was that after the surgery? About 2 months or something like that, or?
Yeah, 7 weeks.
Yeah.
It's 2 months.
Yeah. And before going further, so they took a bone graft. Did they also took from your hip or only coracoid?
No, from coracoid.
Okay. So it dislocated, and then they said like maybe it's the muscles that are.
Yeah, because of the nerve injury. Yeah,
yes,
and the muscle are very weak. So the doctors in Oman, they decided to do one thing. They said in Oman we don't have a good doctor for the nerve injury, like for the brachial plexus or radial nerve.
Yeah.
They don't have a good doctor. So they decided to send me outside Oman to India. They said they have in India they have many good doctors. So yeah, they sent me on last year on June. Okay, they sent me on to India, to New Delhi. So yeah, I went to India. I met the doctor. He said we will do first the nerve test. After that, we will see for the shoulder. So I did the nerve test. The doctor told me your nerve, it's getting recover. That good thing. It's good part. But about the shoulder, he did the MRI and he did the CT scan. He saw the joint. He said your joint in horrible situation. So you might be in a few years forward. You will need to replace your joint. We will do the replacement for the joint. But in this time, we will try to do our best to do revision surgery,
So was it only the joint, or was it the screws that they have misplaced, or like what was the problem?
No, it was because of the joint. Because they say the joint was not stable for a long time and it was moving, and a lot of bone, you lost a lot of bone from the joint.
Okay.
So yeah.
Did they say this in Oman too? Like, did they see this, that you had a lot of bone loss?
Yeah, actually, yeah. In the second surgery, they saw it. and they told me the same thing. The doctor told me, or the Omani doctor told me the same thing. In forward, in many years, after many years, maybe you will need to do another surgery for replacement.
Okay.
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 So in June, after I saw the Indian doctors, they said we will do the surgery for your shoulder, and we will bring the nerve team. They will be with us in the surgery to see what's the problem with the nerve.
Mm-hmm.
So they did the surgery.
When? When was it?
In June, and I think 16th of June,
Okay.
2025.
Yeah.
Okay, they did the surgery. So, and they also they told me they will take the bone graft from the hip. Okay, because they from the concrete bone they already took it in Oman.
Mm-hmm. Okay.
So I did it, and after the surgery, when I wake up, I felt like fire on my hand again, and it's more than the second surgery. You know,
Mm-hmm.
it's more and more. So I told the doctor. He said, "Okay, I will ask the nerve doctor. He will come to you." So the doctor of nerve, he came to me. I said for him, "Did you do anything for the nerve?" He said, "No, I wasn't in the surgery room." I said, "What the fuck? How is it?" Because they promised me there will be a nerve doctors
Mm-hmm.
in the surgery to
Yeah.
see what's the problem with the nerve. They told me, no, there was no one from the nerve team. So they promised me something and they didn't do it,
Wow.
unfortunately. Yeah.
That's bad. That's bad.
Yeah, it's bad. It's bad. So I talked to my government because my government, they sent me to India.
Yes.
That's what happened for me. And after one, and also after only one week of the surgery, my government sent me. They told me just back to Oman. We will arrange everything. So after 1 week, I just back to Oman. I did CT scan. I did the X-ray, MRI. You know what they did? What did they say? That they said the doctor who did for you the surgery for the shoulder, he didn't take enough of bone graft. He took small piece
From the hip, right?
from the hip, so it didn't match in your joint.
What?
Yeah. So
That is
so,
so.
so
So what does that mean? They didn't take enough, so they said you have to do it again or
you do it, yeah, you need to do it again.
a third time.
For yeah, I already did the third time in India. So after 1 week, when I back to Oman, I did the other test. They saw the shoulder the shoulder not in right position because the doctor didn't take enough bone.
But wait. So you done one Latarjet in Oman, one
Yeah,
Latarjet in India, one Latarjet in India,
yeah.
and then now a third also in India, or
No. After that, I told you I back after the surgery. The surgery in 1 week, I back to Oman.
mm-hmm.
So my doctors and government, they decided they saw to see another country, better country, to do this kind of surgery, and they are specialized on the nerve condition and the shoulder in one time. So they send my case, my medical reports to many countries. They send it to France. They send it to America. They send it to Germany. They send it also in UK. But Germany was the first who responds.
Okay.
Okay. So before in April in this year, in April of 20th of April, they sent me to Germany. So in exactly in Charity Hospital
Mm-hmm.
in Berlin. So I met the first thing, the first person I met the nerve doctor. He was Professor Vaikuzi is very famous here in Berlin, and he was honest to me. Was very honest to me. He said, "See, uh, the good part, it's your movement in your hand. It's great. It's getting recover. But the bad thing, it's the numbness and the sensation part. It will last forever." I said,
Wow.
"Okay, I'm gonna accept that. The good thing is the movement will be recovered. That's the good part. The sensation, it's bad, but it's not bad as than the movement."
Yeah.
So I said, okay. And he said, but also we will be, the team of the nerve will be in the surgery when the orthopedic team will do the surgery. The nerve team will be there.
Hmm.
So I said, okay. So I met the second day, I met the orthopedic team. I met the doctor. He's a great doctor. He said, see, we will do the surgery for you, but this surgery will be last surgery you will do it. For what he mean for the repairing, for the revision surgery.
Yes.
But after this surgery, you will need, of course, to
The
replacement for,
joint.
yeah.
Yeah. Yeah. Hmm.
So, and at the beginning of May, they did the surgery for me. And
How long is that ago? When was the surgery?
yesterday, I just completed 1 month.
Okay. So 11th of May, something like
Yeah.
that. Yeah.
Yeah.
So 1 month. Yeah. How is it? Like, how are you doing, bro?
I'm doing great. Even the I feel like a shoulder are not stable, not let's say not stable. Let's say it's not in the right position because I already spoke to the doctor. He told me maybe because of the muscle are very weak, and we are talking about the fourth surgery now.
Hmm.
Yeah, maybe because of the muscle very weak, and after the when you start the physiotherapy, I'm sure the shoulder will be in the right position.
Okay. How is the hands?
I feel good. Yeah, the movement good now,
You
but
can move it?
yeah, I can move it. It's okay now,
Okay. And the
but
numbness is still there.
the numbness is still here,
Okay.
and my muscle are very weak because I didn't do physiotherapy or any training for it almost 2 years.
Hmm.
So yeah, he will. Yesterday told me I will need to see you after 2 weeks to remove the sling, and after that we will decide to do the physiotherapy.
So does that mean that you have to stay in Germany
Yeah,
or okay? And like, who is paying for that? Like your government or
yeah, my government.
oh,
Yeah, because
I
the first mistake was because of the government hospital.
yes.
Yeah.
Wow, 29 years old for surgery. I never heard this before, by the way.
Maybe I will broke the world record number.
Yeah, like they told me like I had one surgery, so one Latarjet, and they told me like it is very hard to have a second one. Most of the time, if it is not working, you have to get like a fake, like a new joint, like a prosthesis.
Uh-huh.
So I think it's interesting that they did 3 or 4 surgeries on you,
Mhm.
but like the way you feel now, does that mean that it is better than last ones? Like you are 1 month post surgery, you can move your hand, so that is much better, right?
Yeah, for sure.
Yeah. And what is the protocol like? Because 2 more weeks in a sling, so that is 8 weeks then in the sling.
No, 6 weeks.
Oh yeah,
Six.
for yeah, 1 month and 2 weeks. Yes, that's 6 weeks. Yeah, and then you start with physio in Germany too.
Yeah, or maybe only to start it in 2 weeks. After that, maybe they're gonna move me to Oman.
Yeah. Wow, this is tough, because I had nerve damage myself, and that is also the reason why we have contact, because you told me like I have the same. Yours
Yeah.
is yours is worse than mine. I think the positive is that the nerve is not like fully cut off.
Yeah.
Yeah. Does the surgeon say that everything is going to be all right? Like, are you going to fully recover from the nerve damage, or
He said, as I said about the movement, the fully recover will be. But about the sensation part
Yeah.
and part, that will be forever.
So that's a positive, right? In my
Yeah.
in my case, my surgeons, and I had the same like you. Of course, yours is worse, but
Uh-huh.
he was not sure if I was going to be able to fully move again. So what I hear you say is that your surgeon is saying like you will be able to move again, like fully. That is amazing, right?
Yeah, but for the nerve part only, about the movement for the shoulder, he said it's not gonna be fully,
Mm-hmm.
you know, the movement. You will able only to raise your hand like that in 90 degrees.
Okay.
But let's hope maybe it will be better than 90 degrees.
Yeah.
Yeah.
Yeah, I hope that for you too. But I remember for myself, when I was in the same position, I was thinking like I would already be happy if I can lift it 90 degrees, right? Because if you cannot move it at all, the only thing that you can think is like I want to just be able to at least use my arm and do things, right?
Uh-huh.
Like, what about your job? Do you have a job
Ye-
or?
Yeah, as I said, I'm working army. I'm a militarian guy.
Yeah,
So yeah, but right now I'm in vacation, medical vacation.
yeah. In Belgium, you cannot go to the army if you had like, I mean, it would be hard to go to the army with these kind of surgeries.
Yeah, the doctor told me already. Maybe they will try to give me a medical retirement.
Mhm.
So yeah, let's hope everything will go good. And yeah, that
How are you dealing with this? Like, it must be lonely. Like you have to travel alone and wait and have patience and like how are you dealing with all these things in the head?
the overthinking killing me, bro. The overthinking killing me. You know,
Hmm.
after any surgery, I'm thinking if if I if it's possible, I can move my hand like before. I can play football before, like before. You know, I
Hmm.
can live my usual life like before. It's it's overthinking. So, but it's after that I remember it's only in the God will. Everything in the God will. God will everything he did, he write it for you in your future, what your future will be. Yeah, we are Muslims, we say like everything happened for you, it's on purpose, you
Hmm.
know. Yeah, on purpose. So maybe the God want to test you. If you
Hmm.
will be patient, you will, if you can wait for this.
Yeah, I think this is an interesting point that you are making because I spoke a little bit about my faith on my YouTube channel, but not like a lot. And the reason why I am doing this is because a lot of people are just coming to the channel to see about the Latarjet. People are not always coming to listen to somebody speaking about his faith or his religion. But because you are bringing this up, maybe we can have a little conversation about that because for me, my faith has been the most important thing. For me, it is the most important thing in my life, right? But it has been super important for me during this period of not knowing and having nerve damage and also thinking like, because in the beginning you are like, why is this happening? Like, why is this happening to me? Like, so many people have successful surgeries and I am the guy who has like this nerve damage and I believe in God. You know, I'm like dedicated to my belief, and I pray and I read. In your case, probably the Quran, and I read the Bible. And the question that I had like is, well, like, what is the reason that it happens to me? And I don't know how you deal with it, but for me, like prayer was like it is a daily thing in my life. But prayer, like I was more praying in that time, and I pray a lot. But for me, praying was a way to find more peace and also trusting like I trust, and also for you I trust that the thing that you are in, like the process, like this whole challenge, I believe that that's my what I really believe is that this will be used for something good. You will get out of this by the will of God, and I really believe that, and you will get out of this and you will have something that is very valuable because you are now in a learning process to also see that everything that we can do, we cannot take it for granted because in a finger knip it can be gone. At
God.
least that's what I told me. Like I have to understand and respect that we are blessed, like just by being able to move. And really, brother, I think that you have to remember that you are blessed that it is not cut off.
Of course.
That was the way that I was talking to myself. Like, don't forget, like, it's not cut off. So most of the nerve damage heals. I think there are many things, but I think in your case, it is annoying that you don't know when and how fast, and you are traveling. But the faith part, as I hear you speak, like in the beginning, I see that you are very dedicated to your belief. For me, that was the one thing to focus on in that period, because you can speak to me and you can speak to all your friends or your family or your doctor, but they can listen. But for me, like really being in contact with my faith, with God, it's different. But I know that you know that. I don't have to say that to you because, yeah.
Yeah. The most important thing is the faith, and never lose your faith with the God. Never, because if you lose the faith, you will be like a crazy guy. You will illusion like that. You will be overthinking, and in that case, I'm pretty sure you're not gonna recover. Just put your faith on God. Put your faith on God, and everything will be great. I'm pretty sure it has been 2 years for me. I'm suffering from 2 years, but I didn't lose my faith with my God. Alhamdulillah. So I'm pretty sure after this surgery, inshallah, that means inshallah, when we are Muslim, we say inshallah that in the God will, the God will.
If it's God's will, yeah.
Yeah, I'm pretty sure that will be my last surgery. Even there's many doctors, they said, and maybe after 4, 5, 6 years, maybe you will need to replace your joint. But I think I'm pretty sure I will not do that surgery, because I have the faith now that this surgery will be the last surgery, and after that, everything will be smooth and great, inshallah.
Did the neurologist say something about neurolysis? It's like a surgery where they like move nerves.
Yeah.
What did they say about that to you?
Before I met the doctor, he said, before 6 months, I met some guy from Dubai. He almost have the same problem you have. But the negative thing, that guy, he couldn't move his hand at all.
Okay.
So the surgery did the nerve, and he saw the nerve has been cut it off at all. So he told me, I think he took the nerve from his leg, so he moved it to his hand. So yeah, and after 1 year in Berlin, that guy his recovery was very awesome. He almost the movement was better than before, as he. But in my case, he didn't say that. He said, I'm pretty sure that your nerve not cut it. Maybe there is pressure on your nerve, or maybe there is maybe like a small cut. They cut it little bit, But in that case, the nerve will recover by himself.
Okay. Sounds like this doctor is very good. Like if he can say these kind of things, like if he is sure about the recovery and stuff, I think then he is, well, of course it's relative, but I think he must be good. Otherwise you wouldn't be there, right?
He was he was very honest to me. And that's the positive thing. Before I didn't tell you, before the government decided to send me to Germany, they sent my case in December. They sent it to Thailand, because Thailand have also many good doctors for the shoulders and for the knees. So they decided to send me in Bangkok in Thailand. So I went to Thailand in December. I went to 4 hospitals, 4 big hospitals in Bangkok. All of them you know what? All of them, they said, we cannot do this kind of surgery for you. You in horrible situation. We cannot. And
Oh.
I remember one doctor from Birmingham Hospital, and he was professor. You know what he said for me, bro? He said, we will not gonna do the surgery for you. And not only me, any doctor in the world, he cannot do the surgery for you. Just live your life like that without move your hand. And
What the?
what I was,
That is crazy. That is crazy, bro.
yeah, I just told him, okay, all right. So I go out. So after 3 weeks in Thailand, I back to Oman. So my government decided to do like another searching.
Mm-hmm.
So yeah, they send it to me in Germany. So I just need to get fully recover. I will back to Thailand. I will tell this doctor, you say you cannot, I cannot do this surgery for you. So I want to do this thing. I just waiting for fully recover.
You have to do it.
Yeah, I
You
will.
have
I
to
will.
do it.
I
Yeah,
will.
yeah. Well, but it is crazy because some people like, and I, of course, I cannot feel what you feel, but I have been through this myself, and we are looking for like improvement. We are looking for people who can say to us like it's going to get better. There's a solution, and if somebody like if a doctor says to you like you cannot fix it, nobody will do this. Like, why is he even saying that? Like, I think this is I cannot wrap my mind around it because this is something it doesn't help you. In contrary, like it makes it worse.
Yeah, yeah. He's feeling the your sensation part. You know
Mm-hmm.
that part from you. So, but he didn't. He didn't. He couldn't with me. Because as I said, I have a strong faith.
Mm-hmm. Amen.
So,
Nice.
yeah,
Yeah.
yeah,
So I assume that you would never nobody like you wouldn't how can I say this like about Oman about the
yeah.
surgery in Oman. I think nobody should do the Latarjet in Oman then if or like how do you see that right now in your mind?
Let's say I'm not saying my doctor was bad for
Mm-hmm.
latter. To be honest, he did the surgery very well. The shoulder was in the right position. The only thing, he he touched the nerve. So he touched the nerve, and after the surgery, when I met him after two months, when he know it, there's like a injury, nerve injury. He said this position, this place, it's the nerve place.
Yeah.
So it can happen. It can happen for anyone. And also in India, they said for me the same thing. It's the
Yeah.
the place.
Plexus
So
brachialis, right?
brachial plexus, yeah.
Yeah. Yeah. But okay. Okay, but I think it's interesting that they send it you to another country because, of course, my surgeon also hit a nerve,
Hmm.
but they tried to fix it themselves. And of course, I didn't have a dislocation after Latarjet, so it's different.
Hmm.
But it's interesting that they helped you to find another surgeon in another country. Um,
Yeah, maybe because of the, I think in Europe, you need for like a insurance card to do the surgery. I think in hospital,
yeah, yeah, yeah.
But in Oman, no, we don't need to do insurance. We have many hospitals for government, and the medical treatment. It's fully free, and the
Oh
studying,
wow.
all of it free.
Okay.
The citizens, when any mistakes happen from the doctor side, so the government will decide to help you in any way. So yeah, the mistake was from the doctor. So because of that, they didn't found any surgeon, the nerve surgeon in Oman, good nerve surgeon, they didn't found in Oman. So because of that, they decided to send me outside Oman.
Okay. So it sounds that they are helping you and like and generally they are supporting their people.
Yeah, yeah, yeah.
Okay, that's
Not only
good.
not only in Oman, in all of Gulf country, from Emirat, Dubai, Kuwait, Saudi Arabia, because I met many guys here from Gulf country. I met yesterday, I met a guy from Dubai, and also I met many people from Saudi Arabia in the same hospital, but in the different situation case.
Mm-hmm.
But yeah, I met a lot of people here.
Yeah, I mean, it has been an experience. You've been to Thailand, you've been to India, you've been to Germany. That's,
Yeah.
that like that's crazy. Okay, so to make a long story short, in what is the next big thing coming up? In 2 weeks, you can start physio. Is that correct?
Yeah, I will
Okay.
remove this. The doctor said we will start to do the physiotherapy for you.
Okay. Are you able to already do stuff with the arm, or do you have to be in the sling without moving?
I'm removing the sling for maybe for 2 hours, 1 hour, just to do like massage for the muscles.
Okay.
The doctor told me to do like this. So just for 2 hours, and after that, I put the
Yeah. No pendulum swings, no other things, just the massage. Okay.
no, I don't.
Okay. Yeah. I'm very curious. So in 2 weeks, I will put it in my agenda because I really want to see how you are proceeding in the coming months and weeks. Of course, you too. But if you are open, I would be happy to have you on the podcast in like a month or something, or maybe 2 months, whatever fits for you.
Of course, bro. Anytime.
Yeah. What about the atrophy? Do you know atrophy? Is the muscle gone? Like the muscle, is it like very
Weak.
yeah, not only weak, but like you could see my muscles, but
Okay, I mean, I know it. No,
yeah,
there is no atrophy in my case. Alhamdulillah, that's the good part.
yeah.
They didn't need to remove the muscle from any place to put it here in my shoulder.
No, but I don't mean that. Like atrophy is if you have like a big muscle and
Mhm.
then you are in the sling because you are not using the muscle is like shrinking. So
Sure.
you are losing like the size of the muscle. Is that the case with you, that you are losing the size of the shoulders muscles, and or can you see the difference between the shoulders?
Yeah, and I told you at the beginning when I told the doctor the shoulder it's not in the right position. What I saw, the shoulder it's not in the right position. He said for me because of the muscle. It,
Yeah,
uh,
totally. Yeah, okay.
yeah, because of the
Yeah.
muscle. Yeah.
Okay. Yeah, okay, got it. Right. Yeah. So let's do another podcast in a few weeks or month, because I'm sure that people who are seeing this podcast, they want to follow up on you too. Like, is there anything that I have not asked you that you want to share? Maybe some things that are on your mind, or something that you still want to share about yourself or about your situation?
No, I think I told you everything. I just want to thank you for your channel, for a great channel, because before the surgery, I was searching a lot of lethargy. Before two years, I didn't find anybody talking about the lethargy. So before the surgery, before 1 week of the surgery in Germany, again I was searching about the lethargy. So I saw your page. So I said, is his case similar
Mm-hmm.
of my? So you remember I spoke to you in Instagram. So you said, yeah, I have also the nerve injury. So yeah, bro, I want to thank you about what are you providing for the people.
Thank you, bro.
So it's great page, and I'm supporting you, bro.
I appreciate it. Yeah.
Yeah.
I think one of the nice things about this channel is that I come to meet people,
Mhm.
and we have been in contact for a little bit right now, and I'm grateful. And I'm going to pray for your healing, and I know that you're praying too. But like one thing, I cannot give you anything. But the only thing that I can give you is like stay strong, keep the faith and the good hopes, because that is the thing that is going to help you mentally. And I really believe it's getting better. And you don't know how long it's going to take, but it's going to get better. So let's start with the physio in 2 weeks, and I hope in a week or 6 that there's going to be a 500% increase. But let's definitely stay in touch, and let's just arrange another meeting pretty soon. Is that good for
Sure.
you, bro?
Yeah, of course, bro, of course.
Okay. Last question. Have you
Yeah.
an idea, like how long are you in Germany? So in 2 weeks you have the physio, and then for how long do you have to stay more in Germany before going back to Oman?
It depends on the doctor reports because yesterday he said from 2 weeks to 4 weeks. So I already now in Germany, I completed maybe almost 2 months.
Mhm.
So after 2 weeks, he will decide to do this physiotherapy. He said from 2 weeks to 4 weeks, maybe for 1 month also. So completely, I will complete maybe 3 months in Germany.
Okay. Maybe if you can, if you want, maybe send me the name of your surgeon,
Uh-huh.
because I have some German people following the channel too, and I think it can only help if we can share the names of good surgeons or people with a lot of expertise. If you want,
Of course,
okay.
no. Okay.
Okay, man. Thank you for your time. Thank you for this
Thank
opportunity to have a talk. God bless you, and
you.
we meet pretty soon. Okay.
Ciao.
Ciao. Take care. Bye bye.